Hey guys, today we are going to talk about the pulmonary effusion. So there is a simple topic, we are going to finish it today. So let's get started. So first, what is pulmonary effusion? Pulmonary effusion is the accumulation of the abnormal protein of a fluid in the pulmonary space. So there is this pulmonary space here, you can see over here, and there's a fluid accommodation. So this is called pulmonary effusion. So let's start with etiology. And etiology has two types, and transudative and exudative. The transudative has also divided into two types. So what is the transudative here? The protein contact is less than 3 grams, and exudative, the protein contact is more than 3 grams. So hydrostatic pressure is due to the high level of blood, and it can cause by the conjunctive cardiac failure, hyperthyroidism, and cardiac tamponade, the fluid in a heart sac, pericardium. And the other one we can see here, oncotic pressure, be due to the protein imbalances. So this can cause by the liver failure, nephrotic syndrome, and malabsorption. And exudative, you can see here, causes infection, TB, emphysema, and inflammation due to the autosomal diseases, malignancy due to primary and the malignant misothermia. And miscellaneous, we can see is chalice effusion. Chalice is due to the chali, due to high level of lactate in the body, or some kind of a trauma in our thoracic due to the tracheal effusion or right heart failures. It can cause by this. And now we can see here mixed syndrome. Mixed syndrome is due to the having ovarian fibroma. When there's a fibroma in ovaries, it can increase the pressure on the right ovarian artery, and a right ovarian artery can lead to the right side pulmonary effusion in the chest. And we can use a special criteria to check this imbalances, and whether it's caused by the protein, or it's caused by the lactate dehydrogenase, or it's caused by trauma or tumor. So there's a simple mechanism we have to check. In the exudative condition, pulmonary will be exudative. Let's check it with the pulmonary protein and serum protein. If it is more than 0.5, this is the first criteria. Second criteria, pulmonary lactase dehydrogenase and serum protein more than 0.6. And if there is pleural lactate dehydrogenase is more than 2.5, of the serum of lactate dehydrogenase, marks of inflammation. So this is the three lights criteria we use to check this pleural effusion. So pleural effusion, let's go with the clinical features. Insidious on chest dyspnea, coughing. There's a lot of coughing, sudden onset. It can lead to this pleural effusion. And chest pain. Examination, bulge, low chest movement. Palpation, you can see here, low chest movement, push trachea, and vocal formitis. Formitis is gonna be low. Percussion, we can see stony dull. Auscultation, low air enter, and ronchi sound. And investigation, let's talk about. You can see here is a CT scan. You can see over here, you cannot even see a white spot here due to a fusion on that area. So let's check it out. Like a 200 to 250 ml of fluid is blunting of the costal or cardial region. If there is a fluid here, you can see over here around the cardiac region. If a 500 ml fluid in a homogeneous white opacity, you will see on concave areas, you see that a white opacities you are looking at here. And if there is 1000 ml, you see a white lung. If there is more than this, you will see whole area will be white. So what we can see, we can take the chest x-ray on the lateral view or decubitus view. If there is pleural effusion caused by the heart failure, we can give the diuretics for 72 hours. Then we can do the x-ray to check if the pulmonary effusion is disappeared. Then if not, we can go with this pulmonary aspiration. We can use the aspiration to take out the fluid. And aspiration, how we gonna do it is a simple process. 4 needle samples, we use it to check the protein level. So exudative, what we can see, if there is a more than 2,000 white blood cells due to infection, more than 1,000 red blood cells due to hemorrhages or malignancies, or we can see the pH values. If there's low proteins, we can check it, the autosomal diseases. If there is a high level of amylase due to acute pancreatitis, or could be chronic pancreatitis if there is a really high level of amylase. And if last, we can check it, the high resonant CT chest, to check tumor or infraction of trachea or esophagus. So there is a lot of things we can check it out during this pleural effusion. So that is for today. Hope you will like this video.